What if I tell you that neglecting your oral health can cost you thousands of dollars, your mess up with your heart, your brain, your confidence, and even your career? Welcome to the Wonder Tooth Podcast. And before I get started, make sure you put code DENT77, and this is to get a free consultation for dental treatment in our luxury office in Princeton, New Jersey. And quickly, my name is Dr. Radwa Saad. I am a dentist in New Jersey, and I'm licensed to practice in Canada, in the United States, and I am the past president of Mercer Dental Society, which is linked with the New Jersey Dental Association, the American Dental Association. I am also a keynote speaker for one of the largest dental companies in the world, which is Dentsply Sirona, which I'm very honored to, and I'm a national speaker with them as well. And today we are going to discuss the hidden cost of neglecting your oral health. So what's going on? Tell me. Okay, first of all, did you guys know that each tooth in your mouth is basically like your fingerprint? It's a very unique structure. It's a very different than any part of your body, like your bones, your muscles is completely different. It's very unique because it has different layers. And we can sometimes get the DNA from the pulp within, from the nerve inside. So this is something, hopefully we'll never get to that point, but I mean, it's very important. Like teeth are very important. The enamel that's covering the outside of the tooth is actually the hardest substance in your whole body, harder than even your pelvic bones, your femur. It's the hardest substance. So imagine what I'm talking about. And the most important part is dental disease or cavities are basically number one disease worldwide. It comes before cancer. It comes before, heart disease. I'm not here to brag, but it's pretty serious. And every year, over 2 million visits to the ER, to the emergency room, is because of dental problems. So how can we avoid that? We can definitely avoid that if you guys listen to the podcast and basically listen to what I'm going to tell you. I've been doing this for over 20 years. I love what I do, and I'm here to share my knowledge. So make sure you listen, and hopefully you'll get, a couple of insights here and there, maybe something that you're going to tell your friends, you tell your families, your kids, what you really need to do. Because, okay, let me tell you, back in ancient Egypt, you see that picture behind me? This is actually from Egypt. So the people who are listening to the podcast, we also have a YouTube channel, so you can see what I'm talking about, and you can see me also, virtually. It's called the Wonder Tooth Podcast, and it is on YouTube. In Egypt, they used to put crushed garlic in the cavities to kind of prevent, the pain, because garlic had some sort of antibacterial effects. But we can avoid that. And let's talk about the costs. I know a lot of patients, they come to my office and they're like, oh, we don't have insurance. How much is the filling? How much is, a root canal? How much is a crown? Oh my God, that's a lot of money, which I understand. And we are here to help. But neglecting your teeth and neglecting your oral health can actually become way, way, way more expensive than just a filling or a root canal or a crown. Way more expensive. And I'm going to tell you that now with numbers. So for example, a filling, it costs around between like 150, maybe sometimes like $300. It is, a stretch, but if you think about it, if you get it done at the beginning, it's a small filling. It can be done. It's probably like a one surface. And what does that mean, one surface? So each tooth, we have to give it like a specific code. So if it's like on one side of a tooth, we call it's a one surface. If it involves like, let's say the biting surface and the side of the tooth, that's two surfaces. If it's between the two sides of the tooth and the top part, it's a three surface. Well, you don't really need to know that, but why did we get to that point that we have cavities now between the teeth? It's because we're not flossing properly. Okay, let's think about this. So each filling is around that amount of, depending of course where you live and if you have insurance and all of, the fun part. What about a root canal and a crown? So I would say approximately it could be also depends if you have insurance or if you don't have insurance, where you live, if you're going to a specialist, it's but the average, it could be between like 1,000, 1,500, 2,000, 25, around that. What about an implant? An implant also costs, and it also depends if you have bone to begin with. You have to listen to my episode about the implants so that you can understand exactly what I'm talking about. So if there is enough width and thickness of the bone and length, you don't need maybe a bone graft. If they pulled the tooth long time ago and you don't have enough bone, then you're gonna need to have what we call ridge augmentation. So it varies, but it could be an implant between maybe 3,000, I would say, to 6,000. It is, there is also like partials, but partials, I don't really like them much because they cause even more harm than good. But it's a good option if you want to basically restore like a lot of missing teeth. And there is, like the full mouth rehabilitation, which is basically, let's say you've been grinding for so long, your teeth are really, really short now, you're starting to see the nerve go, you're getting root canal in every single tooth, and you are grinding and your muscles are like this thick and you are really grinding your teeth. So we need to basically open your bite, restore the function, because at this point you are at a risk of causing a lot of damage to your joint, the TMJ, migraines, ear infections, ear pain, like you name it, okay? And of course, a lot of this sometimes, even if you have insurance, sometimes it's not even covered, like a full mouth rehabilitation, that's not covered by insurance. So insurance is basically like one of my friends, and he works for the American Dental Association. He's a director, like a big guy, big fancy guy. He told me once that dental insurance is basically like having a Costco card. So some of you, if you know what I mean, Costco card is basically like you pay to get, a subscription, and then when you go inside the place, you still have to pay for everything. So this is just like, getting like some sort of a discount, or basically getting it is some sort of it, but you still have to pay for the rest. Costco is not gonna pay for your eggs or your salad. That's not gonna happen. So anyway, just something to think about. So this is basically how much each dental treatment can cost you. So as I said, if you go at the very beginning, get that filling fixed, or if there is a tooth that's completely decayed, it needs to be extracted, like let's say a wisdom tooth, you don't have to put an implant there, nobody really gonna do it. This is, get it done and get it over with, because if you wait, I'm scared, it's a lot of money, I don't want to do this. So what's gonna happen next is basically the physical aspect of it, which is what is gonna happen to your body if you don't take care of the dental neglect. So unfortunately, gum disease, which is untreated gums, which is basically, it means you haven't been to the dentist forever, you didn't get, dental cleanings, you didn't get dental checkups, you didn't get dental x-rays. And dental x-rays is always a big one, because a lot of patients, I don't want x-rays, I don't want radiation. We keep arguing back and forth that it's important, because I personally don't have x-rays. I wish I had x-rays in my glasses, but I don't. But x-rays are important. You need to get them done once a year so that we can check if there is anything wrong between the teeth. We cannot see between the teeth. We cannot see what's going on in the bone. We cannot see what's going on in the jaw. So this is, now I'm gonna tell you, it's a true story. Thank goodness it didn't happen to somebody I know personally, but I am like in a million groups of dentists here and there. And this is a true story, guys. So a patient used to come to that dentist for like few years, and every time, I don't want x-rays, I don't want to get radiation, I don't want this, I don't want that. Anyway, and the dentist would say, that's okay, you're gonna sign a paper that you don't want x-rays. But the thing is, that paper, it means absolutely nothing. You need x-rays, and not a lot, thank goodness, we have good patients, but some of them, sometimes they say, what, I don't want x-rays this time. And I say, it's gonna be only this time, but next time we will have to take x-rays, otherwise I will not be able to see you. And why is that? Because I'm trying to protect them. I'm trying to protect their health. And this is very important. Back again to that patient who didn't want x-rays for the longest time. Every time he goes and signs, I don't want x-rays. So what happened, one time he had jaw pain. He went to the dentist, and she goes, he went to his family doctor at that point. Then they sent him to the hospital, and they took, it was so sad, they took actually like MRI, and they found he had oral cancer. He had cancer in his jawbone. That could have been diagnosed if he would have those x-rays taken on a regular intervals every year, once a year, so that we can see what's going on. So please, when you go to see your dentist next time, if they need to take x-rays because you have pain, or if it's been a year since we haven't seen you, or you let them take those x-rays, because it can literally save your life. Okay, so this is like very important today, guys. If you don't listen to anything, please listen to that. And a dental x-ray, as long as it's like digital, you're wearing, you know, the lead apron, basically you're protecting your body, which all the dentists, they have that. You're protecting, you know, your neck. Of course, you have to. If you are pregnant, we usually put a double sheet, like 2 of these on top, and we're protecting this. And it's digital x-ray. I doubt that there is anybody is using now the old type of x-rays, the analog, and you put them in those. I doubt. I think everybody at this time, they have digital x-rays, which basically like one small x-ray, it equals like eating a banana. Okay, don't you guys eat bananas around here? Nobody's a minion. I love bananas. So basically, yeah, and a full mouth of x-rays, digital x-rays, it's basically like you took a trip, you traveled, you took an airplane from here to there. It's not major. If you stayed in the sun for like 15 minutes, summer is coming, you know, everybody's gonna be sitting outside. It's not major, but once a year, and then you're gonna have all the protection to protect your vital organs and to protect your thyroid. Okay, now let's go back and talk about, you know, possibly what can go wrong. So gum disease cannot be diagnosed without x-rays and without a dental exam. And why gum disease are important? Because the type of bacteria that live deep down there are completely different than the type that live in your mouth. You know, your oral cavity, your saliva has millions of bacteria. They live together in harmony, you know, exactly like your stomach. You have, you know, like bacteria in your gut. And as long as they're living in harmony, so they're not causing problems. But if one gets more than the other, then we have some aggressive bacteria. And these are completely linked now with heart disease and stroke. So people who have gum disease are at a higher risk of having 2 to 3 times more heart attacks and strokes. And how can we prevent that? Get your teeth cleaned. Not a regular cleaning, but you need to get a deep cleaning. And if you go back to listen to my previous episode, it explains to you what is the difference between gingivitis, which is reversible, and periodontitis, which is bone loss and bleeding, and basically it's irreversible. We cannot fix it. And that also takes me to something a little bit in between, which is called periodontal maintenance. So if you have gum disease and you're getting deep cleaning, that means that you have to be seen after the deep cleaning every 3 months for something called periodontal maintenance. And periodontal maintenance is completely different than a regular cleaning. Regular cleaning, you come, oh, we just check a little bit, we clean, you know, we go on the outside, on the top part of the tooth. We don't go deeper in the gum. Periodontal maintenance, sometimes we have to put some numbing gel and go a little bit deeper and basically scrape off a little bit more while we are checking the pockets to make sure if there is still an active pocket, which means an active infection. Active infection means when we are checking and there is bleeding coming. So we have to go and clean that. And periodontitis, basically, it is a gum infection. It's not going to go away. The bone is never going to grow back where it used to be. Like this is, unfortunately, it's not going to happen. But we need to maintain it now. We need to make it stable and stay at the same level so it doesn't get worse and basically risk of getting heart attacks, strokes. And why? Because the type of bacteria is different. Some of them are actually linked also to gut problems, you know, like stomach problems. Some patients, you know, like if you have the H. pylori, it is linked, you know, with gum disease and, you know, stomach bugs. What else? Diabetes. If you are diabetic and you have gum disease, that needs to be treated right away. And why is that? Because it's an inflammation, it's an infection, and it's in your body, and you're diabetic, so you are at a higher risk of getting an infection. So if you have untreated gum disease, your blood sugar is going to be high through the roof, and you're taking medication and nothing is happening. And you know, if you are diabetic, that can lead to a lot of other complications, not just like blood sugar, okay, eyes, arthritis, God forbid, you know, toes. It's pretty serious. And all the pregnant ladies out there too, you are at a very high risk of, low-term babies, preterm because of untreated gum disease. And you can go back to a couple of my episodes, which I interviewed an OBGYN about that particularly. So if you are pregnant now in your early stages, make sure you should get a cleaning every 3 months throughout the pregnancy, not once every 6 months. I would go every 3 months, even if just to keep everything clean, okay? And now not all, but also it's now linked to Alzheimer, so dementia. Untreated gum disease is also now linked to Alzheimer. So imagine heart disease, let's say heart attack, stroke. So you're going to the ER. It's going to be thousands of dollars, like not even your health I'm talking about, but thousands. I'm talking about the cost right now. Or God forbid, like a preterm baby. So imagine you are waiting for your bundle of joy and something happens, and that's because you didn't take care of yourself. So this is also very important. Or Alzheimer, you're going to end up, come on. So now you understand where I'm trying to explain to you guys. Neglecting the oral care is really can cost you thousands and thousands of dollars. It's not because I want to pull this. It's much more than this, because everything is linked. Everything is linked. So how can we prevent that? How can we prevent, the neglect? How can we take care of ourselves? Oh, it's very simple. Okay, if you are listening now, take some notes, because really, number one, brushing. We're going to brush like a pro. We're going to brush like, twice a day at least, after, like morning and evening. I personally brush 3 times. After every time I eat, I brush my teeth. And I'm telling you, even if you don't have a toothbrush, just brush with water. It has to be a soft toothbrush too. Flossing is a key. Flossing at nighttime, and there is a video also that we shared how to floss properly. So we're gonna brush twice a day, 2 minutes each, and then we're gonna floss really well. Mouthwash, I don't care. You can use anything that you like, or warm salt water. I always tell my patients there is nothing better than warm salt water. Period. Some of the companies are going to be upset with me, but I'm just telling you, like, personally, I don't like a lot of chemicals. So natural, get some salt from your, I don't care if it's like sea salt or whatever salt. It's just some salt and warm water and you're good to go. What else? Get your 6-month checkups and cleanings. If you don't have any underlying, medical conditions, you need to be seen every 6 months. Every 8 months is not good. Every year is not good. I had a patient this last week. She's a perio patient. She is a perio patient. Like, what does that mean? Like, she has gum disease. You remember, it's irreversible. She's supposed to come every 3 months. And then she came to me after 1 year. I haven't seen her for a whole year. 1 year, no cleaning, no nothing. And I'm like, what happened? Oh, I forgot. I'm like, what do you mean you forgot? So now I'm checking and I'm like, you're bleeding everywhere now. Oh, I thought this is going to be cured. Well, it's not going to be cured. This is not going to go away on its own. Like, I'm going to look in my mirror and be like, oh, my teeth are going to be good today. No, unfortunately, you have to do the work, guys. And the work that you need to do is, brush properly, floss properly, and get your 6-month checkup and cleanings. And if you are a perio patient, which means you already have irreversible gum disease or gum infection, so you need to go every 3 months. And if you are at a higher risk because of, you are at a higher risk of a heart attack or stroke or diabetes, you need to be going. If I were you, I would go every 3 months or every 4 months. But you have to go to see your dentist, and they can check x-rays and they can check and they can tell you. But basically, that's what needs to be done. Now, let's talk about what else. The psychological aspect. The psychological aspect is very important, because I have patients who come to me and they are like, I am very embarrassed, and they are very intro now. They feel like they are withdrawing from the society. They don't want to talk to people. They don't want to smile. They don't want to have their pictures taken. And why is that? Because they are very ashamed of the smile. They're ashamed of the teeth, how they look like, the discoloration or the fractured, or, the tooth they're not aligned properly, and they are missing tooth in the front. They are like, and this can really affect yourself. I've had a lot of patients, they don't want to smile. They don't want to talk. They smile like this, and they just like, and it's very painful to actually see that. we are here to help you guys. And I'm talking like we are here, we are humans, and we are here to help you. We are here to make you feel good about yourself. I'm not a psychiatrist, but I'm here to help this part. I want you to be able to smile. And when you smile, you are gonna feel good. You're gonna feel better about yourself. And I just had actually a virtual consultation. Remember when I said to put the code is very important, because I had a virtual consultation last week. A patient, he's from Norway. He called, I'm in New Jersey, and he called me from Norway because he has a big problem in his front teeth and nobody's able to help him. And it's like, it's involving like, you know, crowns, it involves like implants. And I'm like, this is what you need to do, 1, 2, 3, 4. And the guy is willing now to come so that we can fix that. And I am more than happy because I love what I do. And I'll be more than happy to help him with this. But that's what I'm saying. People are really aware, self-aware of their smile and, you know, the society around us. So I know another patient, well, that was, I mean, I told him I'm going to have to make an episode with you because very handsome guy. And he decided to get those lumineers, the stick on, whatever, the snap on, got them from, I don't know, online from Facebook. He got an ad. Oh my God, they look amazing. So he got those snap-on veneers and he put them on his teeth and he kept, you know, working with them, functioning with them. They look white. They don't look like teeth, but they are, you know, something. So basically what happened, the teeth underneath them, they got so deteriorated, so completely gone, destroyed. And he came to me and he was so embarrassed to take those. And I said, just take them out. I've seen worse. I mean, I've seen everything, really. I've been doing it for 20 years. And I looked and I said, I understand what's going on. We're going to fix this. He actually gave me a review. If you go on my Google review, I was surprised. He put a picture of himself with the big smile after his teeth were fixed. And he almost cried that day. And I said, we're going to sit. It's going to be a few appointments. We're going to be best friends. But I'm going to fix this and forget about it. And he kept telling me, I need to tell everybody, do never, ever listen to whatever you see. Don't believe everything you guys see, like a snap-on or something you buy. It's not custom made. Everything is open. Bacteria goes underneath it. Plaque goes underneath it. And then it's a big problem. Just like the veneer techs, you know, if you also listen to my previous episode, just they do whatever, acrylic, boom, put it on your teeth. And then it destroys your teeth underneath them. So you please, you know, get a consultation from a good dentist, a cosmetic dentist. Also, if you're going to fix something in the front, you have to go to somebody who they know what they're doing. And we are here to help anytime, guys. You know, we are in Princeton, New Jersey, and I'm going to put the address in the show notes and I'll be more than happy to see what can be done. So yeah, I mean, after we fixed that, he works in sales. His sales gone up the roof. I had another patient. She worked in Michael Kors. You know, all the ladies, you know, we like Michael Kors. She became her, like the top, you know, seller in the store because of her smile. And she kept saying, everybody was saying, oh my God, you have a beautiful smile. Well, we fixed that. When she came to me, she was very nervous. She was very like intro. She didn't want to talk. She didn't want to smile. She didn't want to engage with any conversation. Now she's like top seller. I mean, it really can change your life. A smile can really change your life. A healthy smile, not just any smile, not like a snap-on veneers. So basically, we spoke about, you know, the financial aspect. We spoke about the medical aspect, and we spoke about the emotional aspect and how we can prevent that. So I think it's, you know, it's not rocket science. Just please brush, floss, go to your medical checkups. Oh, tongue scraping too is very important. Tongue scraping, you gotta clean your tongue because sometimes that can cause, you know, bad breath. And basically just live happily. I mean, life is, you know, life is beautiful out there. We just have to take care of ourselves. And I am here to help you, you know, if you need anything. And don't forget, you know, that the mouth is literally your gateway to your wellness. It's a self-care. You know, when you're taking care of your mouth, of your health, this is self-care. And you have to do that in a crazy world, you know, like everything is so fast, everything is so competitive. And if you cannot really take care of yourself, who will? And don't forget to take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.